So welcome today. I am Sharon Henderson, and I am the Director of Infection Prevention for Wake Forest Baptist Health, which we have most recently merged with Atrium Health. So I think we are now being called a Legacy Wake Forest Health. My background is infection prevention. I've been in infection prevention at least 20 years. I was in another health system for about 10 years. And then I've been in this health system for almost 9. So I have oversight of here at Winston campus. I also have an infection preventionist at Wilkes and Davie, and then also at Lexington, and then 2 at High Point. And so I'll continue. So I was asked to talk about hand hygiene, and this is near and dear to my heart. And so I'm first going to start out with some Germy facts. So there are between 2 to 10 million bacteria on our fingertips and our hands, and also in what we call our anticupal space, which is the front side of your elbow. That's a lot of germs. The number of our germs on our fingertips actually doubles after we use the bathroom. Phones, there's been multiple studies on phones, and they have about 10 times the number of germs on a toilet seat. So that's pretty disgusting. So, we need to think about how often do we clean our phones. And of course, phones go everywhere with us. So they can contaminate, our cars, our house, but lots of germs. So when you do not wash your hands, what happens is you move germs that are actually living on your hands to perhaps the food we eat, the drinks we drink, the things we touch. We think about germs from unwashed hands moving to other objects like children's toys and handrails, drink machine buttons, door handles. Here in our organization, I always think about elevator buttons because I think about how many times elevator buttons are touched. But really look around you and see what are the things, the common things that you frequently touch and probably your coworkers touch also. And then how often are they really cleaned? Germs from unwashed hands, like I said, they can move in different areas. I talked about the food you drink. I even think about like when you go to a soda machine, you're getting out your Coke, you're getting out nabs. Those are areas to think about too. So how long can germs live? They can live a long time on a surface if it's not cleaned. So for instance, I think of E. coli, because that's a pretty common germ, especially when you're dealing with meat and sometimes vegetables. E. coli, if a surface is not cleaned, can live 16 months. That's just unthinkable, but they can. And then things like norovirus, which causes diarrhea, illness, salmonella, we see that in foods, can live a long time on surfaces. So that's why it's important to not only wash our hands, but also to clean surfaces. So when you look at the data, they state, CDC, 80% of our common infections are spread by our hands. So you think how much reduction of infections we could make better if we just simply washed our hands. Germs actually can grow on soap bars, so that's why a lot of places have moved away from soap bars. And, we came out with the hand soap that's liquid or foam because we knew that soap bars could actually grow germs. The other thing we need to think about that from animal sources, our meat sources such as steak and chickens and turkeys and such, feces from animals it is very common for them to have salmonella and E. coli in them because it's just inherent, or it just lives within the chicken or the animal. So when we're processing, especially, or working with raw meat or like butcher shops, there's always invisible amounts of feces or poop, if you want to think about it, in that meat. So we have to be very careful when we're handling meat. Some other just hand hygiene washing facts are: washing our hands for at least 15 seconds decreases bacteria by 90%. So it works. If you add another 15 seconds, it reduces it by 99.9%. That's almost 100%, which is awesome. One of the things that I discovered early on when foam soaps came out, that they might be a little bit less effective than liquid soap because it already comes out as a lather, whereas liquid soap requires the friction, to build the lather, to create the lather, which actually enhances thorough cleaning. So there is a less amount of soap and foam in a single pump than its liquid counterpart, which I always thought was interesting too. So you have to be cognitive and think about how much are you using? Are you using enough soap? And especially if you're using a foam soap, because as I said, you're going to get a little less soap, and you will already have the foam, the lather there, but actually that kind of works against you when you really want to create a lather, and that's why it's better to use a liquid soap. Soap, what it does is it binds to the germs and it gives a ride down the drain. So it actually, that's why we use soap, because the germs bind to that soap and it makes it easier to get rid of those germs. Regular soap actually works. Some people ask, does it have to be antimicrobial? No, it really doesn't, because what you're wanting is that soap, that lather, and then, rinsing so that the germs go down the sink. Dove soap, just if you're getting dry skin in the winter and for home use, Dove soap is actually the #1 dermatologist recommended soap because it's less drying. Hand washing actually has been proven to reduce sickness and people being absent from work by 29 to 57%. It helps us prevent from getting sick. It also reduces sickness with diarrhea by 23 to 40%. So again, if we do hand washing, it's going to keep us safer, not only at work, but at home as well. And we're able to work and not miss work due to illness. So when we perform hand hygiene, what's the most common areas we probably miss when we do hand hygiene? And this is where we focus on, even with the nurses here in our hospitals, because obviously we want them to do an excellent job so that we keep our patients safe. So our most common missed areas will be under our fingernails. How many times have you looked at your fingernails and you've seen things under your fingernails that you didn't even know was there? It's like, how did that dirt get there? So we miss our fingernails, the backs of our hands, between our fingers, so you want to interlace your fingers and you really want to do a good action of cleaning there because that gets missed. Also, the tops of our fingernails. And the key here is you want to keep your cuticles in good condition, because if they're rugged and they are dry, it allows germs in there. So that's why we always talk about, really focusing on your hand washing and doing a good job. Hand washing is actually required by the CDC and Public Health Department for most diarrhea illnesses. And that's because hand sanitizer just doesn't work for most diarrhea diseases. It doesn't work in getting rid of the germ that's causing the illness. So we'll move along. So soap and water are also required when hands are visibly dirty. You don't want to put hand sanitizer on dirty hands because all it's going to do is spread the dirt around. But that's why I require soap and water when your hands are dirty. Actually, you should do soap and water before eating. Wash your hands before you eat. Think about all the places your hands have been and what they've touched, and always after using the bathroom. As we said, those toilet seats, the bathroom is a very dirty place. It sometimes doesn't get cleaned frequently, so the germs can kind of build up there. And, we're going to the bathroom, and our urine and our feces or poop, many times it includes E. coli. We have it in our system, in our urinary and our intestinal tract. So when we talk about steps of hand washing, what's the right way and the wrong way? The main objective, of course, is to do hand washing. So the first thing you want to do is you want to get your hands very wet, because remember, we're going to put soap on there, and we want to make sure that soap spreads to every place, just like I said, in the palm of your hand, on top of each of your hands, between your fingers, your fingernails, under your fingernails. So you want to have enough water that you create a good lather. Lukewarm water is preferred. Hot water can dry your hands. And then the problem with hot and cold water is if it's too hot, we don't take the time necessary to wash our hands for at least 20 seconds. And if it's too cold, the same applies. Our hands are cold, we don't want to be using cold water, so we just don't wash long enough. So lukewarm water is preferred. The other next step is that we add soap. Obviously, what we want to think about is, do we add enough? A little dab is not enough. The minimum is the size of a quarter, and that's the minimum, because remember, you're going to get into all those spaces. Lather up, create a good lather, okay? And then, did you rub all your surfaces at least 20 seconds? You may need 20 more, but 20 seconds is the bare minimum. Rinsing thoroughly. Where this is key is that you want to make sure that all your soap is gone, okay? No leaving of soap on the hand, because it can be irritating and drying. And the problem with that is, like I said before, it can create cracks in your hands, and then that's where germs can invade and can make you sick. So you want to make sure you get all that soap off. And then the next step, which is what people tend to miss, is you want to wait. You've rinsed your hands. Now you want to wait a second, and you want to get a disposable paper towel, and you want to dry your hands. Don't turn off the water yet, but dry your hands, and then you want to take that paper towel, and now you want to turn off the faucet. Because remember, that faucet's contaminated, and you did all that hard work on washing your hands, and now if you reach down to turn off the faucet, you just recontaminated them. And you thought you did a good job, and you did, but now you've recontaminated. So just, take a second, think about what you're doing, and then take your paper towel that you just dried your hands with, and go ahead and turn off that faucet of water. Now, one of the other things that I try to teach everybody is, you discard that paper towel. And then if your door has a handle to go out, you want to reach for another paper towel and open that door handle with a clean paper towel. Because just think, you did all this hard work, you cleaned your hands, you rinsed them, you turned the faucet off correctly. Now you're going to recontaminate your hands if somebody didn't wash their hands going out the door. So it's just those few seconds that we need to stop and think what we're doing so we don't recontaminate. We all make mistakes. And if you realize you did, you just go back and wash your hands and start over. Gloves. Let's talk a minute about gloves. Um, Gloves, you always want to perform hand washing um, or hand sanitizer before placing gloves on. And the reason for that is that gloves have microperforations in them. We can't see them by the human eye, but the FDA actually allows a pretty high failure rate on gloves. Um, so that's why you want to do hand hygiene before you put on your gloves, because your hand hygiene is your first layer of defense because you've washed all your germs off. Now your second layer is your gloves. So when we get ready to remove our gloves after we've done our task or we finished, what we were doing, and we want to remove our gloves, what I always recommend is that you have your gloved hand, and I'm going to show you, and you pinch the glove in the middle and it. And then the next glove I have here, I'm just kind of going to go under with 2 fingers up under my glove, maybe 2 inches or 3 inches, and I'm going to peel it off and throw it away. And that's the way you keep from recontaminating yourself. And it takes getting used to doing it that way, but it really does prevent you from contaminating your upper arm. Um, and it's a better way of doing things. Now, also, after we have removed those gloves, now you want to do hand hygiene again. So we do it before we put on gloves and after we put it on, after we remove our gloves. And again, that's a layer of defense for you. And think about it. Did you touch anything else after you washed your hands? When you wash your hands and you've done your paper towel and everything, sometimes we absently minded, we touch our face 100 times a day. There's been studies done about that. We don't realize we touch our hair, we touch our face, we touch our eyes, our eyelashes, our mouth. So think about where these hands have been and where you're touching up here. Some other key habits really to keep you safe is keep your nails short, clean, well groomed. And that means, so that you don't have cracks in there. Nail polish should not be chipped, should not be peeling. Again, great place for a germ to hide. CDC does not recommend artificial nails, and there's a couple reasons for that. Germs can hide, but also with artificial nails wrapped under there and in the adhesive, and then that can cause fungal growth. And if you've ever seen anyone with fungal growth in their nails, it takes months and sometimes expensive medications to get rid of it. Be mindful, as I've been saying, of the surfaces you touch. Other hands have been there, and did that previous person wash their hands? Lotion. Let's talk about lotion and hand cream. They're also an element of hand hygiene. Especially here in the winter, dryness increases our cracks and entry points for germs. And lotion, what it does, it rehydrates and puffs up our skin so germs can't enter. Now, some lotions are not compatible with gloves, especially those that are perfumed. They can break down gloves. And what I mean by that is they can thin the glove or they can cause holes in them. And again, the gloves, most of them have not been tested against a lot of our perfumed hand creams. So we really don't know if we're protected or not. Some things to be aware of. Again, just focusing on that germs can hitch a ride, and being cognizant again of what you touch, especially your face, your hair, your clothing. You could brush off a piece of lint or you brush off your clothing. So just think about where those clothes have been also. And lastly, I always try to empower the staff here and my team, as well as the doctors and everyone. We're all about safety. So speak up. If you see a coworker that, perhaps forgets their hand, or he's in the bathroom and they get ready to run out, they didn't wash their hands, I've always talked about how we can do it in a calm manner. We can be polite, we can be very factual, and we can be very respectful. And usually, the way I lead that is I may say, I noticed you didn't wash your hands. I'm sure you just forgot. I want to protect you. I want to protect my coworkers. And of course, we want to protect patients. So I'm just reminding you that you need to wash your hands. And then if they decide not to do that, I've done the best I can. And then if I see that person continue to not wash their hands and maybe put others at risk, I may escalate that to their boss, or I'll try another time or two and say, I'm just worried about you and I don't want you to be sick and carry this home to your family. Most of the time, the reason we forget to wash our hands is because we're disoriented. Our nurses are too. Um, and we just have to remind and we have to look out for each other, um, especially during this time of year where flus can start to appear, diarrhea illnesses increase in the fall and winter. And of course, we have COVID-19 right now that we're trying to keep everybody safe. So thank you for your time. And I hope this has been helpful. Um, and thanks again for the opportunity. I love teaching about hand hygiene and how to keep people safe. So I wish you safety and thank you.